Most of the time, if your doctor is offering you a clinical trial, they're the ones that are participating in the clinical trial, and your care would stay with them.
In terms of clinical trial enrollment, typically the rules regarding travel or physicians that you see is that once you start a clinical trial at a certain institution or with a certain physician, you stay with that institution or that physician. There are certainly some centers that will have, one physician seeing all the patients on X clinical trial, a second physician on Y. That's not typically how we do it. And the way that we do it here is, if I'm caring for a patient who in the midst of their care is eligible for a clinical trial, I'm the doctor who enrolls that patient on the trial. I'm the doctor who follows them through that trial. I'm the doctor who works with all the side effects on that trial and then decides when it's time potentially to come off the trial. We think that continuity of care is very important. Certainly in the midst of that, you're going to see other people. We as a cancer center work in a large group, so you would see other members of the group. But I think for most of our patients at least, they don't have to change doctors. They can stay with the doctor they're comfortable with, who can then guide them through why that clinical trial might be right for them and can guide them through the treatment on that trial. I think most patients prefer that and find that comforting.